Hello everyone. We here at the Nordic Welfare Center and the Unit for Deafblind Issues are very happy to welcome all of you to today's webinar, Psychological Health and Deafblindness. Today's webinar is hosted by the Nordic Network for Psychologists Working on Deafblindness. At the end of today's sessions, we will have a slot called Questions and Answer, or as I prefer, Questions and Reflections, where you are very welcome to post questions in the chat or to share your own experiences. This part will not be included in the YouTube video that will be available later on our YouTube channel. I will now leave the floor to the network chairman, Ulrik Skov Hansen, who will introduce today's topic. So please, Ulrik, the floor is yours.
Hello everyone and welcome to this webinar. My name is Ulrik Skov Hansen and I work as a psychologist in Denmark at the Specialty Consultancy for the Deafblind. And I am currently the coordinator of this network. And this network is called Nordic Network for Psychologists Working on Deafblindness. And one of our aims is to spread relevant psychological knowledge about deafblindness. The network was started in 2024 and we have members from different Nordic countries, Sweden, Norway, Denmark and Finland. In the latest revision of the Nordic definition of deafblindness, it was emphasized that there is a high risk that the physical and also the psychological health as well as social life will be affected. And we in this network have been talking a lot about what does this mean? How can we understand psychological health? What is it and how is it related to deafblindness? So this is the aim of this network. First in the network, we will hear Jude Nicholas from Norway talk about the two concepts, psychological health and mental health. He will talk about what the different concepts is and how they are related to one another. After that, Rasmus Haugaard Petersen from Denmark and Sofia Hansdottir from Sweden will talk about what we know from a scientific and clinical perspective about psychological health and deafblindness. They will talk about what we know from these perspectives, but also talk about how psychological health can be supported. Lastly, we will hear from Jackie Lehmann Hansen from Denmark, who himself is living with deafblindness, and he is also a chair of Deafblind Denmark, and he will talk about a first-person perspective and what he knows about psychological health from his perspective. So we are very, very happy to have these different people come together and starting a conversation about psychological health and deafblindness. So let's get started, and I will now hand the word over to Jude Nicholas.
Hello everyone, my name is Jude Nicholas. I'm a clinical psychologist and researcher attached at the University Hospitals of Bergen and Tromsø. In this introductory lecture, I will be talking about psychological health, what is in relation to mental health. So the initial questions which will be addressed are, do the terms share common characteristics to these two sides of the same coin, or are the terms categorized within a larger whole, or they fall under the same umbrella? So before flipping the coin or opening the umbrella, we need to understand the new update of the Nordic Welfare Center's definition of deafblindness. So deafblindness is a distinct disability described by the Nordic Welfare Center. And the update from 2024, one of the main implications is that there is a high risk that the physical and psychological health as well as social life will be affected. So going back to the initial questions or beginning of the questions which were asked, mental health and psychological health is both two sides of the coin and are a part of the same concept, that in the sense it falls under the same umbrella. So psychological health, it's a component of mental health, as you could describe mental health as a state of mental well-being that enables people to cope with stresses. And most specifically, mental health conditions include mental disorders and psychosocial disabilities. On the other hand, or as part of the other side of the coin, psychological health encompasses a person's emotional and psychological well-being. Psychological health includes a person's emotional health, behavioral health, and social health. So, what are the two important pillars of psychological health? So, in a way, psychological health is more than the absence of psychological distress or mental illness, but it's the presence of balanced emotions, thoughts, and behaviors. It's also about having a sense of meaning and purpose in life, good social ties, and feeling of contributing with something or someone. Uh, the two important pillars of psychological health. So how does psychological health or the challenges of psychological health would look like in people living with deafblindness? Psychological health challenges in deafblindness is not just the physical challenges of sensory loss, but has been described by these authors. It's also the psychological and emotional burdens that come with it, which are often less visible, but equally impactful on quality of life. Likewise, the experiences of fatigue, which is reported in people with deafblindness, is not just a physical or mental exhaustion, but also an existential issue that stems from a lack of the sense of personal agency and a feeling of disconnect from one's values. To understand psychological health and well-being, we could see that it falls into a three-level framework involving A, societal level or the community or social unit, B, relational level, connecting with others, and C, personal level, character strengths. So we'll use some time to go through these three levels of psychological health. So on a societal level, it's about encouraging the creation of environments to support psychological health and well-being in a variety of settings. Theory-wise, or more theoretical understanding has been put forward by Erich Fromm from the 1950s, who described psychological health cannot be defined in terms of adjustment of the individual to his society, but on the other hand, that it must be defined in terms of the society to the needs of man, of its role in furthering or hindering the development of mental health. So it's again the importance of seeing how society has a responsibility for each individual person's psychological health. More in detail, the ecological theory of Bronfenbrenner looks at the individual's psychological health in relation to more complex layers of environmental factors, like the micro, meso, exo, and macro systems, which again play an important role from the environment that influence the individual's psychological health. And in more recently, the new ecological theories of this model emphasize macro systems also within subcultures and other subcultural variations. For instance, diversity, equity, inclusion, social justice, and disability. Likewise, it also emphasizes mesosystem relations, such as the virtual microsystems, like social media influencers and bloggers. Each of them have an advantage to advance a person's psychological health, or they could also result in social isolation. In that sense, hinders a person's psychological health. The next level, it's on the relational level. It's about connecting with others and doing something meaningful that provide possibilities for psychological health and well-being. On this track, we could understand the three aspects of acting, like keeping physically, mentally, socially, or spiritually active; belonging, developing a sense of belonging through social support networks, participation in groups or community activities; and committing, taking on challenges and committing to activities and hobbies that provide meaning and purpose. These are all aspects of on the relational level, which will influence a person's psychological health. On the third level, it's on the personal level. And here we talk about the person resource characteristics possessed by an individual that is uniquely providing the foundations for psychological health and well-being. So what are the person resource characteristics? This could be described as: one, positively valued traits that uniquely influences the individual journey from learned helplessness, such as seeing things as fixed and unchangeable, to learned hopefulness, seeing possibilities, focusing on strengths and purpose, especially in the face of adversity. The other part of person resource characteristics are the organized mindsets that each individual uniquely have and influence the person's environment in the range of the person's or the individual's thoughts, feelings, and behavior. Right. So these are aspects, or the resources are on the personal level. Research-wise and empirically, 6 components of the person resource characteristics have been described from theories of philosophy and positive psychological functioning. From the earlier philosophers of Aristotle and to more modern theories, these components of person resource characteristics have been identified. So what are the 6 components of the person resource characteristics? The 6 components of person resource characteristics has been identified by Reeve, and here are there. The one is self-acceptance. This is the knowledge and acceptance you have of yourself. Number 2, it's autonomy, the ability to make one's own choices and act on one's own values and interests. The third is purpose in life, the pursuit of meaningful goals and a sense of purpose in life. Fourth is the personal growth. It's about enhancing capabilities and realizing one's potential for fulfilling life. The fifth is positive relationships, and it's again the establishment of quality ties or bonds to others. And finally, it's the environmental mastery and the ability to manage complex environments to suit personal needs and values. In summary, in the theories of psychological health, as we saw it through the societal, relational, and personal frameworks, are needed to be considered when promoting and improving psychological health and well-being for for a person with deafblindness. Here's a literature list of the articles and literature which have been used in my presentation. So thank you for listening, and good psychological health to all of you all.
Thank you, Jude, for a great introduction of the framework on what you actually mean by psychological health. My name is Rasmus Holger Petersen. I'm a psychologist and I'm a knowledge consultant at the Specialist Consultancy for the Deafblind in Denmark, located in the North Denmark region. And I will like to tell you about, or come with a very brief recap on what we can find in the research literature. And this is not an exhaustive list at all, but just to mention some areas that I have looked at. And then I will go through some of the research literature. So I tried to do some systematic searches on this research, but if we look towards the literature, we have the scarcity of research looking into how psychological health is affected if we look at the total group. But there have been studies looking into specific subgroups. For instance, there have been a focus on age-related deafblindness or dual sensory loss. There's been a focus on aging with deafblindness, and there's been a focus on Usher syndrome. And I would like to point some of them out. So, a few of the studies, as we have mentioned before, focus on the health issues for people with deafblindness. The group of people living with Usher syndrome have been looked at in terms of their health issues. These studies find a risk of developing depression, anxiety, and stress as some of the central psychological health issues. Moa Wallqvist also made this diagram that compares the physical health and psychological health in a group with Usher 2, a person with Usher 2, and a Swedish normal population. So on the horizontal axis, you have the different health issues, and on the vertical axis, you have the percentage of the group who experiences these issues. Like Jude mentioned, fatigue is a commonly reported issue when it comes to people with deafblindness, marked with this blue circle, and is also seen in this diagram here. Sober review has also been made on psychosocial factors that influence the quality of life for people with Usher syndrome. This is a review of the literature on various psychosocial difficulties that people with Usher syndrome encounter in everyday life. So on the basis of 21 articles, they divided the factors into 4 different themes. First theme is about ontological security and autonomy. This is a feeling of unpredictability, a sense of trust, worry about the future, feeling of vulnerability. We have access to information and communication, whether it is information about the syndrome, but also difficulties entering and following a conversation, needing to have several strategies in both sign language and sign supportive languages. Social support. Some experience lack of awareness and consideration in school settings, needing specialized settings. It impacts relationship in family and friends that need to adjust to deafblindness. And then mental well-being. There's a higher risk of developing psychological disorders, needing to cope with different negative emotions, but the review also describes some activities that individuals with Usher syndrome engages in that gives a feeling of empowerment. Even though people with deafblindness is a heterogeneous group, and this review specifically focuses on Usher syndrome, these themes or factors could be generalized to a bigger population, so also the population of people with deafblindness. But as Jude mentioned in the start of the presentation, we might also look at psychological health from not only this mental health issue perspective, but also a perspective that looks at the psychological health and the strategies that people with deafblindness uses to manage life. We need to flip the coin, not only focus on vulnerability, but also on the competences and resources. So what are the strategies that people use to live a meaningful life? This was the focus in Ain and colleagues' study on life strategies of people with deafblindness due to Usher syndrome type 2A. On the basis of focus group interviews with 14 persons with Usher syndrome, several strategies came up. The overall strategy was being at the helm, which is about the participants' active, cognitive, and emotional striving to be the person in control of life domains that they considered of importance. One sub-theme was about how to resolve or prevent challenges by remaining active, using devices, support, or by sharing knowledge, and another sub-theme is about comforting oneself by appreciating the present, maintaining a positive self-image, and alleviating emotional pain. The study offers valuable insight on the various strategies the persons use navigating a life with Usher syndrome. Another relevant study I would like to mention is a study by Peter Simcock, Jill Manthorpe, and Anthea Thinker. It's called a Psychologists approach to aging with impairment, the managing and coping experience of older people aging with deafblindness. In the study, Simcock and colleagues argues that people with deafblindness often is perceived as vulnerable and dependent, and ask 8 participants with deafblindness how they understand vulnerability in relation to themselves. 3 major themes came up during the analysis of the interviews, one being taking action to protect self, coping strategies, psychological coping strategies, and the last major theme was about accessing and using care. The study stresses how people with deafblindness are active in managing and coping with experiences in which they feel vulnerable. Focus is on the participants' resilience, how they successfully overcome challenges in life. And this was just to mention a few of the studies that I have chosen to get an impression of how psychological health is described in the literature when it comes to people with deafblindness. Now I will pass it on to you, Sophia.
Thank you, Rasmus, and thank you, Jude, for your presentations. I'm Sophia Hansdotter, and I'm a licensed psychologist at the National Resource Center for Deafblindness in Sweden. I'm also clinically active at the Deafblind team in Stockholm. So we've got an introduction to the topic of psychological health and what research says about it. And I will touch briefly on the topic of what we can do to support psychological health from the societal, relational, and personal perspective. So how can we think about psychological health from a societal perspective in deafblindness? If you think about everyday life for a person with deafblindness and what human beings usually tend to appreciate, that you can be a part of society as a citizen that contributes to society, to feel included, and so on. So if that is not the case, if there are laws that doesn't give you the rights to be a part of society fully, the rights perhaps are not that strong, and accessibility to work, education, media, news in times of crisis, and accessibility to digital platforms and public transportation and so on. All these factors in society, if they tend to make you feel included or marginalized, how does that affect psychological health in the long run? So we can think of these repeated experiences of marginalization and exclusion as a potential risk factor for psychological health in the long run. So as long as society is not like best case scenario where there is limitless access to guides and interpreters and all information is provided in braille and in a tactile sense and so on, including persons with deafblindness. As long as this is not the case, how can we support from a societal perspective? One thing that is important is to validate experiences of marginalization and not downplay it. So we need to validate it, and then I think it will be easier to continue and try to find out what might support. According to the Nordic definition on deafblindness, information is one of the main areas affected, and so this is something that we all can do to support and enable persons with deafblindness making informed choices. So that means spending some time making important information accessible, so that the person can make informed choices about their lives and rights in society. This will increase their sense of control, which is a health factor for psychological health in the long run. We can all spread information about deafblindness to, especially to decision makers and persons of power in society. We can support deafblind associations and individuals with deafblindness when they are advocating for their rights. Because even if persons with deafblindness are the true experts on what it's like to live with deafblindness, sometimes decision makers and persons in power, they tend to listen to professionals more than persons with deafblindness. So we need to be allies in this way. So from a relational perspective, what is it about deafblindness that might affect this? One of the main areas, according to the Nordic definition on deafblindness, is communication, that it could be affected. And this could differ from different situations and over time, depending on situational factors and also your own, if you have learned new skills to communicate in a new way or not. So this could affect your relationships, of course, when communication becomes difficult in different situations. And also the area of orientation and mobility. If it is difficult for you to get to a social gathering, this can also make you less active socially. And the area of fatigue, when you don't have so much energy to spend, you might choose to, even if you are able to get to a social gathering and you know that you could communicate there, if you don't have the energy left to do it, you might choose to stay back and stay home. So this could make you less active. So all of these factors can lead to social exclusion, which is a very stressful thing for any human being. So again, in a best case scenario, everyone in society would be able to communicate using clear speech, sign language, tactile sign language, and so on. Then the relational perspective wouldn't be so affected. But since the reality doesn't look like this yet, what can we do to support individuals with deafblindness in the relational level? A few things that we can do is to actively support persons with deafblindness to maintain the relationship that they do have, both family, friends, and also to make new social contacts. And one way to do this is to use active problem solving about a specific situation. For example, if you know that a person is worrying about the next big family dinner, perhaps spend some time just trying to actively find solutions for different problematic areas, how to get there, how to make communication easier. Can you talk to the host of this dinner beforehand to make the lighting as optimal as possible and the background noise as low as possible? And or can you have an interpreter there, or things like that to support in problem solving. And it can also help to inform the person's social circle, family, friends, and also colleagues about simple strategies that helps immensely. And we can also support persons with deafblindness to make new contacts within the deafblind society or with someone else living with deafblindness, if they are ready, of course. I think most of us professionals working in the deafblind field, we can see that this is usually the most helpful when the person gets to this point, that they get to know other people with deafblindness. Then they can become a community and support each other, and it's very beneficial. So on a personal level, what affects psychological health in the long run? One way to look at this is how a person is dealing with their deafblindness, especially if it's acquired and progressing over time. That means dealing with recurring crises. So what does a person thoughts about this, and what emotions are arising, and what behavior is being conducted? For example, if you have very negative thoughts and judgmental thoughts, and you have strong emotions and it's difficult to cope with them, it might make you behave in a very avoidant way. So what we think, how we feel, how we behave, how we deal with things has a huge effect on psychological health in the long run. So what can we do to support psychological health on a personal level? Like Rasmus said before, most people with deafblindness they develop really good strategies over time to deal with their lives and their deafblindness. So this is a good thing. Sometimes, however, a little help might be needed from someone, a counselor, psychologist, or a therapist. And then you can work with some personal factors that support your psychological health in the long run. One turning point that is common is when a person with deafblindness get to the point where they stop avoiding life because of your deafblindness, and instead start to try and find out how can I live life with my deafblindness, and try to develop these good strategies that we've talked about earlier. One strategy is that you are becoming open about your deafblindness and one's needs. You can advocate for what you need in different situations. This is very helpful. And psychological flexibility is an area that encompasses many different points, like clarity about what one values in life. So there are practices that can be done to clarify that. And this is really good when you have a limited amount of energy to spend. So if you are really aware of what you value in life, then you can use this energy wisely and spend it on what really matters to you. Take action to do that. So using active problem solving that we discussed earlier is always helpful when it comes to situations that can be affected. However, when it comes to difficult situations, and such as crisis, grief, changes, difficult thoughts, emotions, then inner skills included in the psychological flexibility model is helpful to practice, such as acceptance and self-acceptance and self-compassion. And when it comes to acceptance, it doesn't mean that you accept injustices in society. It's not about that. It's more acceptance of your difficult experiences. That is more helpful than to have a lot of resistance against them. Practicing mindfulness, coming back to the here and now situation where you have a possibility to affect what's going on right now, as opposed to when you spend your mental energy ruminating about past events or worrying excessively about future events. And also to think about your identity in a flexible way. Is it possible to include deafblindness as a part of your identity, but not letting it taking over your whole identity? Instead, try to see that your identity encompasses many important areas in your life, where deafblindness is just one part of it. Things like these might help on a personal level. So these were just a brief presentation about how we can support psychological health. And I've focused mainly on acquired deafblindness. I hope that we will be able to address congenital deafblindness also in the future. And now I'm happy to hand over the word to Jackie.
Og tak for, at jeg må komme og være med til at give et indspark fra døvblindes vinkel i forhold til døvblindhed og psykologisk sundhed. Jeg hedder Jackie Lehmann Hansen, jeg er 36 år, jeg har USHA 2A, og jeg bor i Danmark, og jeg er formand for Deafblind Denmark. På det her webinar, der er der noget viden omkring psykologisk sundhed og den mentale sundhed. Og jeg ved, at I tidligere har været inde på nogle forskellige områder, som skal være på plads i forhold til psykologisk sundhed. Og her vil jeg komme med et indspark fra min side. Når man er døvblind eller får en diagnose som døvblind, så oplever man ofte, at man allerede fra start er anderledes end andre. Og det betyder, at vi meget hurtigt får ind i vores verdensbillede, at vi er anderledes, at vi ikke kan det samme som andre, at vi skal have ekstra hjælpeforanstaltninger, vi skal have hjælp til forskellige ting, til at gennemføre ting, til måske også skulle have hjælp også til, at vi kan gennemgå livet på den måde, som vi faktisk selv som døvblinde ønsker. Og herunder der snakker vi jo også i forhold til at have ret til selv at bestemme, hvad vi vil med vores liv. Hvad er det egentlig, vi ønsker i vores liv? Personligt kan jeg jo fortælle, at jeg har haft et ønske om at skulle uddanne mig, have en højere uddannelse. Men i Danmark har det ikke været muligt, fordi at man ikke har så fleksibelt uddannelsesmuligheder, og det betyder, at jeg desværre har været forhindret i at tage videreuddannelse. Men jeg er dog et sted i dag, hvor jeg ønsker at være, men jeg ved, at andre døvblinde står i en situation, hvor at de begrænsninger, der findes i samfundene, faktisk sætter en barriere for selvbestemmelse over eget liv. Derudover er der også noget i forhold til, at når vi ikke selv kan bestemme i vores eget liv, og selv kan vælge vores fremtid, hvis man kan sige det sådan, så går det også ud over den personlige vækst, vi ønsker, altså det, som vi egentlig ønsker i vores liv. Og det tror jeg simpelthen bunder helt tilbage til, at vi ikke har de samme muligheder for andre. Der bliver også sat nogle barrierer, som ikke er nødvendige. For eksempel et fleksibelt uddannelsesniveau, tilgangen til samfundet, få en plads på arbejdsmarkedet, få mulighed for at have et aktivt fritidsliv, få mulighed for at selv bestemme, hvornår man vil ned og handle, hvornår man vil til koncert, hvornår man vil ud at rejse. Det er jo nogle begrænsninger, som vi som døvblinde ret ofte oplever, fordi at vi har brug for hjælp fra andre mennesker. Og så har vi jo nogle systemer, som der jo desværre gør, at vi skal planlægge os til rigtig mange ting, og det er ikke altid muligt. Nu kan jeg sige, at jeg selv lever et meget aktivt liv, og derfor også mange gange har brug for nogle spontane ting. Men hvis jeg har brug for personlig hjælp, når jeg skal ud, så kan jeg ikke være så spontan. Så er der brug for, at jeg planlægger mit liv et halvt år frem. Og det tror jeg ikke gavner psykologisk og mental sundhed. Tværtimod, vi skal hele tiden planlægge alt, hvad vi vil. Og det tror jeg ikke er sundt heller for døvblinde. Det der jo også er, det er, at jeg tror for rigtig mange døvblinde, især i Danmark, der har vi jo Deafblind Denmark, som er en forening, hvor vi mødes med andre ligestillede og får nogle sociale netværk den vej igennem. Men der bliver måske kigget på de muligheder for også at kigge på, jamen, hvad er der af netværk uden for vores egne foreninger? Hvad er der af netværk uden for døvblinde området? Og det tror jeg kan være med til at skabe noget selvindsigt, og det kan være med til at skabe noget selvtillid, at vi som døvblinde også får mulighed for at se, eller får en viden om, hvad der sker om andet end lige på døvblindområdet. Og på den måde tror jeg også, at vi bliver bedre til i forbindelse, altså i sammenhæng mellem både at være i et netværk af døvblinde, men også i et netværk af andre, som ikke har døvblinde udfordringer, at det kan skabe en selvtillid hos os, en selvaccept af, hvem vi er som menneske, fordi vi får nogle input, som vi måske ikke vil få, fordi vi kun er sammen med ligestillede. Og det tror jeg er noget, der er lidt overset, at vi jo også er en del af et samfund, og derfor også skal have mulighed for at indgå i det samfund, der findes ude omkring i de forskellige samfund. Og jeg tror også, at hvis man kommer ud og ser, hvad der også sker, så vil vi også vide, hvad det er, vi har ret til som mennesker, hvad det er, der kan give os livskvalitet. Og jeg synes, at der er en tæt forbundenhed mellem livskvalitet og psykologisk helbred. Fordi det er noget, vi selv bestemmer. Og hvis alt bliver trukket ned over hovedet på os som døvblinde, så kan man da godt få sagt ting på en måde, så det lyder som om, at det er noget, vi selv har valgt. Men typisk, så kan det være nogle barrierer, nogle kasser, nogle rammer, vi skal passe ind i som handicappede. Og det er ikke altid, at vi ønsker at være i de rammer. Det er faktisk sjældent, vi ønsker at være i de rammer. Så hvad skulle der til for at bryde de rammer? Og der tror jeg, at når vi snakker psykologisk netværk, eller når vi snakker psykologisk helbred, så snakker vi om at kigge på os som individer, at vi er døvblinde, ja, men vi har også nogle ønsker, nogle drømmer, nogle visioner for vores liv, som vi faktisk ønsker, vi også kan bidrage med, blandt andet til de forskellige samfund. Og det tror jeg er vigtigt, at I som psykologer og også har mulighed for at tænke lidt ind i, at der er måske en hel masse kasser og en masse rammer og en masse teori. Men hvis I kigger på os som individer, passer vi så ind? Og det tror jeg faktisk meget sjældent, vi gør. Og derfor kunne det være lidt interessant også at kigge på, hvad kunne der skabes hos os enkelte døvblinde, hvis ikke vi skulle proppes i kasser, eller hvis ikke vi skulle ind i forskellige rammer, men at man faktisk kigger på, hvordan ønsker jeg mit liv ser ud om 10 år, og hvad skulle der til, både på det psykologiske, på det helbredsmæssige, men også på det, der giver livskvalitet for mig. Og jeg er sikker på, at vi vil opleve flere døvblinde være tilfredse med sig selv, med samfundet, med systemet, hvis der blev kigget mere på os, og ikke på de rammer, der er sat op af mennesker, som ikke har forståelse for vores situation. Tak.
Thank you, Jude, Rasmus, and Sophia, and Jackie for those presentations. Before we are going to the Q&A session, I will just try to briefly do not a complete sum up, but present some of the points that I heard when seeing this webinar. In the first part, I heard Jude say that psychological health, there's different pillars to that. There's different things in the concept. And one of the things he said was having a sense of meaning and purpose in life, and good social ties, and a feeling of contributing with something. Then Rasmus presented what we know from this scientific perspective about what do people with deafblindness experience. And one of the things he told us about was that people living with deafblindness very often experience this fatigue and how that can affect psychological health. Then Sophia continued on with presenting different things, among other things, these social factors of, if we think about all the things we do in everyday life, how is these social factors connected to our feeling of psychological health? Then at the end here, I heard Jackie say a lot of important things, both this feeling of being different, and also his perspective on how can we be spontaneous in life as people with deafblindness, and that when you are living with deafblindness, it is very difficult to be spontaneous. And I think that ties very together with the things Jude and Rasmus and Sophia talked about, the different factors, a feeling of meaning and purpose and contributing to something, and that a feeling of not being spontaneous can maybe be something that makes that quite difficult. Yes, but now we will go over for the Q&A session, so I will hand over the word to Göran.
From Stockholm, we wish to thank all of you for participating in today's webinar, and especially a warm thanks to all the members in the Nordic Network for Psychologists Working on Deafblindness for hosting this webinar and sharing their knowledge. We wish all of you a pleasant day. Thank you and goodbye.